yelling in front of the kids.
The help we needed. How far we've come.
This is a perfectly healthy child. What's unhealthy are birth alerts, a racist practice that may stop this Indigenous mother from going home with her newborn. Become an ally. Rise above racism in healthcare.
You're watching Rogers TV.
Hello everybody, my name is Jason Piercey and this is Out of the Fog. Straight to it, the Honorable Tom Osborne, Minister of Health and Community Services is here. I got him the whole time. Don't go anywhere. We'll be right back after this.
Your opinion matters, and we want to hear from you. Get in touch with us using our viewer feedback line, your direct connection to shaping the shows you love. It's easy. Just grab your phone, scan the QR code on your screen, and take our quick survey. Share your thoughts, and let's make your viewing experience even better.
Welcome back to Out of the Fog. Sometimes I say I would like to introduce you to somebody. I don't think that's fair to say right now, because if you're watching this and you don't know who the Honorable Tom Osborne is, then I don't know, where you been? Minister, thank you very much for coming out and taking the time.
Yeah, pleasure to be.
And for literally rolling up your sleeves to get to work with us. Currently Minister of Health and Community Services. However, you've had a tenure in provincial government for some time, and it just seems like you want all of the hardest jobs. But like education, and now our healthcare corporation. So I guess next time, if you get voted in again, you just finance maybe, like.
Well, I was in finance, so I enjoy the challenging portfolios. I mean, it's time consuming. Obviously, you know, it creates challenges sometimes in personal life because you're dedicated to the most challenging portfolios. But I enjoy getting in and trying to find solutions.
And I suppose if you're in the more challenging portfolios and the more public portfolios, especially healthcare, coming out of like the pandemic and everything that happened there, and of course there was the renegotiation of nurses' contract, and there was a whole bunch of stuff. They're very public also, and you become the either intentionally or unintentionally sort of the face or the voice of a movement. So, I mean, that can't be easy on an individual either.
I don't get stressed. I mean, if you look at something like healthcare, no matter how many solutions you bring to healthcare, when somebody is requiring healthcare, that is probably the most stressful time in their lives.
Sure.
The most stressful time in their families' lives. So, regardless of how much time and effort you put into healthcare, you're never going to fix everything. And every time you're in a supermarket lineup, somebody's going to tell you about, you know, how long they had to wait in the emergency department.
Sure, yeah.
Or, you know, they heard that somebody, you know, had a wait or couldn't see a doctor, you know. So you never leave work at work. Work follows you everywhere.
Oh, of course. Yeah, it's funny you should say that, because like the audience here and many other people are no stranger to me having had some emergent trauma and medical concerns a couple of years ago, and I have come out of that with a whole new view of our entire healthcare system. And I know that it's probably not true for every particular department, and there are people who have different experiences, of course. Like mental health and addictions, I don't think we're as good at as we need to be, but we are working on it. But I think we're pretty good at this, and I think we're better at it than most people think. And we sort of laughed outside a bit. It was like a buddy of mine was complaining that he had to wait 8 or 9 months for an MRI on his knee. And I was like, dude, that makes you the most fortunate person that needs an MRI. Because the people who need one now, you do not want to switch places with them. That's worse. So I think there's a misunderstanding, sort of.
Yeah, and I mean, our healthcare workers, you know, when you look at it, they've worked through COVID. When everybody else wanted to avoid people and you know, avoid strangers, they worked through COVID. When you need healthcare, it's there. And when you're at the most stressful time in your life, as you've gone through, the healthcare workers are there to deal with you and to see you through that. You know, so you're right. I mean, if you're on a wait list, there are people that are more urgent, which is why they're getting in today. And across Canada, every province in Canada you know, we have wait lists in the 5 areas that are benchmarked. Globally, there are wait lists for these areas, and we've got a shortage of healthcare professionals globally right now. You know, every jurisdiction in Canada, every premier, every Minister of Health is working on recruiting healthcare workers to various disciplines within healthcare to try and shorten those wait lists. But you're absolutely right. If you need an MRI today,
you'll get one.
You're going to get it today.
You'll get one. And because there's somebody else who is more urgent, that doesn't mean they're more important as people. It doesn't mean that whatever your problem is not valid or it's not worth the time to do it. It just means that there's somebody ahead of you that'll die if they don't get theirs. So like they gotta go first, and that's just fair.
Yeah.
So I've sort of been paying attention to some of the things that have happened with our healthcare corporation over the last little while, and I think we sort of have a couple of successes that are currently being announced for people to see that you would have had varying degrees of impact on. And if we could talk about some of them, I think that would be a win.
Yeah, absolutely.
Yeah, so can we start with the nurses? I know it was a little while ago, but it's had an impact now that you can see that's positive, as opposed to just like some people who work hard get paid more and they're safer at work and whatever else. There's other spin-off stuff.
There are. So, you know, I know Minister Cody and the Registered Nurses Union worked through a collective agreement which sees our registered nurses, for example, you know, getting paid as they should be paid.
Sure.
You know, the collective agreement provided much more enhanced benefits to our registered nurses. That has helped with recruitment. It's helped with retention of registered nurses. It doesn't alleviate all of the concerns that you know, registered nurses face, because there's still violence in the workplace. There are pressures. We need, you know, early learning and childhood opportunities in the workplace for our healthcare professionals, because they don't work, you know, 9 to 5.
Oh no, like I can't, that shift work is insane. Like I remember like either visiting friends or family in a hospital or being in there myself and like trying to get my head around which nurses were when, and it's mind-boggling the demand and the schedule that they inherit willingly, because they're incredible human beings. But it's such a different life.
It is. So I mean, even something as, you know, most people wouldn't probably see the impact of early learning and childcare, but something like that, which is through the nurses think tank, looking at the challenges that registered nurses and practical nurses face in healthcare, having that early learning and childcare on site for somebody who works irregular hours will help keep them in the workplace and make their life easier.
Absolutely, and that translates directly to income. It really does. Like I'm working in real estate. I do a lot of new home construction. Sometimes because of weathers, material, labor, whatever, there are delays, and people need interim accommodations, right? And that's hard to find all the time, especially now. But something as simple as having to stay somewhere for a month that can't accommodate your dog. Well, I got to pay $50, $60, $80 a day for somebody to house my dog so I can stay somewhere else. Imagine that's your baby. The amount of money that is to have to, like, why do I work? It just goes all into childcare. Why bother work? So being able to do something like that, I mean, of course it helps with retention. Of course it helps with recruitment. Like, those are valuable things. So one of the other things that has recently been announced is what we're going to do with that old Costco up in the East End.
So we have, and that's an excellent point, ambulatory care. Right now, we have multiple sites where ambulatory care is provided. So, you know, whether it's blood work or getting a scan, you know, or a number of other, you know, so the types of things that you would go into the health sciences or Major's Path or St. Clair's for where you're in and you're out the same day. Those are the types of things that we call ambulatory care.
Yeah, it's probably a good idea if we define for the audience what ambulatory care is, because it doesn't mean everybody who needs an ambulance.
No, so
because they're different things, right?
So if you need an X-ray, an ultrasound, you know, blood work, some, you know, outpatient surgeries, for example, where you're in and out in a couple of hours. Those types of things would be ambulatory care. So they're scattered throughout multiple facilities right now. We're putting ambulatory care in the old Costco building. So, I mean, for anybody coming in from out of the metro region, you're off the highway, quick, easy access.
Oh, I never even realized that. Yeah, that's so true. You're literally, it's just like right there.
You're right there. So
and the parking, that would...
Lots of parking. So, you know, if you look at health sciences or St. Clair's, I mean, parking is a challenge.
And now it'll be eased up because there's so much stuff removed. So there's a lot of ripple to some of these successes.
There is. So, I mean, with ambulatory care, you have less foot traffic at health sciences. You have less vehicular traffic at the health sciences. And it gives us the opportunity, for example, at health sciences, to expand the emergency department so that there's a shorter wait time. So everything we're doing is connected. You can look at all of the announcements we've made over the past year and a half, and they are strategically, methodically thought through on the impact it's going to have throughout the system. So ambulatory care brings all of those things together: greater parking, greater access for individuals. The ripple effects are less traffic at St. Clair's and Health Science. We can expand the emergency department at the Health Sciences Complex, for example.
I mean, you'll literally have more floor space.
More floor space.
More empty beds, more, because, so it eases up a lot of the backlog and a lot of the, which again, makes the lives of nurses or personal care attendants or LPNs, like, it changes those things.
It does. So, I mean, the expansion of the emergency department at the health sciences will be age-friendly, so there will be, you know, some of the amenities will take into account and ensure that it's an age-friendly, whether it's seating or, you know, the lounges, or the way doors are colored and the markings to make it easier. There'll be more waiting area, there'll be more beds so that we can treat more people, less people waiting in the hallway on a gurney, for example. It will help with throughput at the health sciences facility once that emergency. On the other end, part of what backs up the emergency department is access to acute care beds. So we have ALC, or alternate, individuals, ALC, to put it in easy to understand terms. They are people who no longer need to be in a hospital bed, but have nowhere else to go. So they're waiting for either long-term care or personal care or care in the community. So we're focusing on how we get people out of hospitals and free up those beds so that we can do more surgeries and people are waiting less time in the emergency department. So we've been working with the personal care home sector, for example, to take higher acuity individuals. We've got pilot programs with them.
Does higher, just sorry to interrupt, Minister, does higher acuity mean like more specific degrees of care than a personal care home might have historically provided?
Absolutely. So
Yeah,
the
okay.
majority of people right now in a personal care home would be level 1, then level 2. We are looking at, the higher acuity or people with more needs. So the personal care home would be able to provide greater services to individuals, meaning less individuals go into a long-term care, more would go into a personal care, freeing up beds in the long-term care so we can get people from hospital acute care beds into the long-term care.
So that also has to create more jobs too, because these people who have higher levels of acute care, presumably, I mean, I don't know the inner workings, but presumably that higher level of acute care would come from another level of care provider.
Yep, absolutely. Right? So the personal care homes would have to have the staffing and so on. So we've just reached an agreement with the personal care homes which provide them with more revenue and a better ability to start taking higher acuity individuals into the personal care homes, where they have more activities, more community than some of the long-term care. Some folks in long-term care want that social interaction that you'd get in a personal care home.
Yeah.
And they'd have a better quality of life with that social interaction and the activities and so on that they have. Looking at changing the care provided in some of the personal care homes will provide them with a better quality of life because they have more.
I suppose it creates a situation where you have more fitting or appropriate communities for demographics of people.
Absolutely.
Right? So you are more where you belong, both with what you want out of your lifestyle and the needs that you have as a quote-unquote patient.
Yep, absolutely. So there's a number of personal care homes that are doing the, adult day care, if you want to call it that, or dementia care, in the personal care homes now, and those are pilot programs to make sure we get it right, that the personal care homes are able to. So if you look at that, that's not just something for the personal care home. That actually impacts the flow through in the hospital as well.
It eases up everything else.
It eases up everything else. So all of these things have been thought out, working with our stakeholders. You look at the 2 urgent care centers, for example, that we've got an RFP that we're looking to award in the coming days, and that RFP for the 2 urgent care centers will mean that individuals, we obviously need to do a public relations campaign, so when you go to the emergency department or when you go to acute care or urgent care, but the 2 urgent care centers will free up capacity in our emergency department. So you no longer have the 8 or 10 or 12 hour wait, because the folks that are waiting 8 or 10 or 12 hours are there for, urgent care. They need care today or tomorrow.
Emergent care.
But not necessarily emergent care. So they're waiting as long as they're waiting because they need help now. But the emergency department deals with emergency cases first and foremost. And then when they have capacity, they deal with the emergent cases. So if you're waiting 8 or 9 hours, it's because somebody, as you mentioned earlier, has to get in right now.
Yes.
By having the urgent care, we free up capacity in the emergency department so that our healthcare professionals there can focus more on the emergencies, and our urgent care centers focus on the urgent care. And people have a shorter wait time. We're focusing on what needs to be in an urgent care center versus putting them through the emergency.
And I bet that would have sort of compounded positive effect on just the mental wellness of our communities in general, because I can see if I needed urgent care that perhaps didn't qualify as emergent care. I needed to be seen soon, but I'm not at risk of losing my life. To have to sit and wait through my discomfort for 8, 10, 12 hours, whatever, it's going to be very difficult for me not to have a bad taste in my mouth about everything in my life, including my government and the people who are working there and everything. And I'm mad at you because I think that we're in the same room and there's no way he's worse than me. Why is he getting called in, and all of that stuff. And then it relieves a lot of that. Then at the same time, you have the healthcare practitioners who are on call that day, who are in emergency, who, despite their best efforts, can't get to everybody fast enough because maybe it's not the right thing. And there's got to be a little bit of one of two things in the head of a doctor in emergency. They have to feel bad that they can't get the person in faster, but also maybe there's a little bit of like, man, you don't belong here. Like, it's got to be hard. And what you're planning seems to me like it eases most of these things.
It does. So it's providing the right care in the right place at the right time, so that individuals, and as I said, once we open the urgent care centres, we'll do a public relations campaign so that individuals know.
Yeah, that education piece is going to be important.
That's going to be important. It's vitally
What's wrong
important.
with me, so where do I have to go?
Yeah, and when in doubt, always go to the emergency department. But there will be things, if you need stitches, yeah, you need it fixed now, but go to the urgent care centre, for example. So that, you know, that public relations campaign will help educate the general public on, you know, what you definitely go to urgent care for, what you go to emergency, and like I said, when in doubt, go to the emergency. But
broken finger, broken neck.
Yes.
Like, which one?
Yeah.
Interesting.
Yeah.
So speaking of knowing where to go and having somewhere to go, myself included, lots of people have lost access to a primary care physician over the last little while, and that creates frustration. I understand that it's a long game to repair those things. What, if anything, are we working on?
So there's a number of things. We have, well, 811 is there. If you need, you can call. There are nurse practitioners. They can, you know, even prescribe the majority of prescriptions. You know, there are some that they can't, but the vast majority they can. We've increased the scope of practice for pharmacists. So, for example, a urinary tract infection, they can now diagnose and prescribe for that, whereas previously they couldn't. So that keeps people out of the emergency department. The pharmacist can see them very, very quickly, as opposed to waiting for hours in an emergency department. So there are 33 ailments now that pharmacists can diagnose and prescribe for. We've also, with pharmacists, they used to be able to extend prescriptions for up to 90 days. We've extended that. They can now extend prescriptions for up to 12 months before you need to have your prescription refilled by a physician or a nurse practitioner.
Dependent on the nature of the prescription, I assume?
Well, for the vast majority of prescriptions, they can extend for up to 12 months now. There are some that you would need to go back to your physician.
Like opioids, maybe?
Yes.
You're not going to get 12 months worth of opioids from your pharmacist?
Yep, exactly. You know, so by expanding the scope of practice of our medical practitioners throughout the system, we also ease up the pressures. For example, the pharmacists. We also have virtual care now. Virtual care has two stems. One is we're providing virtual care in emergency departments. So if we have the right staff in the emergency department, but we are short on physician coverage, a physician can see you on a screen. The nurse or nurse practitioner, for example, can put their hands on the patient to assist the physician.
I wondered how that would work. So that's, and then the nurse practitioner would be able to explain whatever they're in through
and the
their
physician
examination.
can see you virtually and speak with you. I know Mayor Tiller in New West Valley. Just recently, I heard him in the media saying that the virtual care saved somebody's life.
See, that's incredible.
They got in. If the facility was closed, they would have had to go to the next nearest emergency department, but they got in. It saved their life. So we're providing virtual coverage to emergency departments in rural areas to help make sure they stay open as opposed to closing or going on diversion.
There's also a mobile something.
Yeah, the mobile primary care. So we announced this year too. In the upcoming budget, we plan to announce additional, and basically they're RVs that have been retrofitted to be a traveling doctor's office.
So when you say RV, you mean like a recreational vehicle, a motorhome?
Yep.
And these are traveling doctor's offices?
Traveling doctor's offices. So we have 2 of those that were announced. They are actually, I think just last month or early this month, put into service. They've been retrofitted and actually put into service. So they will go to communities that have a shortage of physician coverage to ensure that, same as many people will remember the traveling library buses.
Sure.
So, the library bus would go into communities, so same sort of concept, but it's a traveling doctor's office. So those mobile doctor's offices will go into communities that have a shortage of on-the-ground physician coverage. So the virtual physician will provide coverage on a day-to-day basis. Somebody who wants to see a physician but doesn't want to travel out of the community,
sure,
the mobile units will actually travel into the community and provide the service.
Thank you very much, Minister, for coming out. It's been a pleasure, and we will be right back after this.
Your opinion matters, and we want to hear from you. Get in touch with us using our viewer feedback line, your direct connection to shaping the shows you love. It's easy. Just grab your phone, scan the QR code on your screen, and take our quick survey. Share your thoughts, and let's make your viewing experience even better.
Welcome back. I have to say, and I've often said, that politicians probably get into the job for the right reason, but then over time it becomes about keeping their job as opposed to doing the job. Not true for Mr. Osborne. A lot of good things. I hope to have him back more, maybe even monthly. Stay tuned. The man's doing good stuff. Have a great night. We'll see you next time.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
We want to hear from you. Provide feedback on this show or find out how you can get involved. Call, email us, or scan the QR code to take our quick survey.
Canada's Got Talent is getting ready for the biggest season ever.
874,624,